There are different ways to monitor your blood sugar. The most traditional way is with a glucometer or a glucose meter. If you're new to testing, the first step is to read the instructions, and you can work with your diabetes health educator, your nurse, or your doctor to make sure you're using the meter properly. When you use your blood glucose meter, you need to start by washing and drying your hands. Clean your finger with a little bit of alcohol and let it dry. Prick your finger with a lancet and get a small drop of blood. Apply that to the test strip. Follow the instructions on your meter to get the reading. You should record your blood sugars. Either write them down in a book or keep an electronic logbook. And even now there's alternate site testing, so you don't always have to stick your fingers. You can stick other parts of the body to get a drop of blood as well. Work with your doctor to figure out what's the best meter for you. Some meters are simple and basic and just give the most simple information. Other meters are more complex and have more detailed information. There are different types of meters that are available for folks in special situations. They're talking meters. They're meters with large buttons and large screens and other things that may be helpful for folks with dexterity problems. If you're checking once a day, we usually recommend mixing around the time so you're not always checking at the same time of day, and that'll give you a sampling of what the blood sugar's doing throughout the whole day.
If I get high readings, such as in the morning, then I may check it later on in the day. But basically right now I only do it about every other day.
Blood sugars can change in different situations, so if you're under a stressful situation or you're getting increased exercise, these are times when you need to monitor more because the blood sugar may be different.
Hey Doc, how are you?
Good, how are you?
I'm fine, thank you.
Everybody with diabetes needs to be monitored, but not everyone needs to self-monitor. Folks with milder forms of diabetes are controlled with diet and exercise or with certain medications may not need to self-monitor. They can see their physician to be monitored every few months. When I look at somebody's blood sugar levels, I'm looking for patterns, I'm looking for times of the day when it may be too high or too low, things that I can target with medications or with insulin to get the blood sugars back on track.
I tend to stay in the high 120s, occasionally getting up into the 150. If I get beyond that, I kind of figure out what did I eat the night before? Did I have an excessive amount of drink? Did I eat late? And then I try to adjust my lifestyle and my eating habits based upon that.
If you're monitoring your blood sugars and you notice that they're going a little high, this is the time to think about your lifestyle, to think about your diet, how much exercise are you doing? Is there something you can do to get the numbers back on track?
I really learned that with proper medication and with proper diet and with exercise and a good lifestyle, that it was something that was manageable.
The key to knowing where your blood sugar should be is to talk to your doctor and find out what is the specific target range for you.